Hello guys. So in this video, I'm going to talk about the topic called absorption. What is absorption? Absorption is the process of entry of drug into the systemic circulation from the site of administration. So it is the process of entry of drug into systemic circulation from site of administration. So in absorption, we have two compartments, right? One compartment is where we administer the drug, and there's one compartment where the drug is absorbed. The compartment where the drug is absorbed is called the systemic circulation. And there is another compartment where we administer the drug. It can be your GIT, it can be skin, it can be the respiratory tract, it can be intramuscular. Okay. What are the size of absorption of drug? Absorption of drug can be, or you can say, what are the size where we administer drug, like alimentary tract by taking the drug orally. It can be parenteral, like intramuscular, okay, or subcutaneously. We can apply drug into the skin, and there is also respiratory tract by taking drug inhalationally. Okay. In this, among these size, the most rapid route of administration or most rapid route of absorption of drug is the respiratory tract, or we can say that the most rapid route is inhalation. You can ask me that why intravenous route is not the most rapid route of administration, because we are giving the drug directly into the systemic circulation, and it is reaching the systemic circulation most abruptly. But you can see that we have said that there are two compartments of in absorption where the drug is administered, and there's other compartment where the drug is absorbed. But in the intravenous route, there is only one compartment. Okay, there is no absorption of the drug. Okay, so you have applied the drug directly into the systemic circulation. There is no absorption, so the most rapid route of absorption is inhalation, not intravenous. Now, what are the factors modifying the drug absorption? The factors are, first of all, we want to say that there is molecular weight of the drug and the molecular size of the drug. If the molecular weight is less and the molecular size is less, it can readily cross the biological membrane and reach into the systemic circulation. So the decrease in molecular weight and size, or small molecular weight drugs, rapidly absorbed into the systemic circulation. Then if the drug has lipid water protection coefficient, or we can say that high lipid water protection coefficient, if the drug has high lipid water protection coefficient, then the drug is more lipid soluble. And we know that the biological membranes are lipid bilayers. So it can readily cross the biological membrane and reach into the systemic circulation. There is also a thing called the pKa of the drug. So if the drug is a weak acid, it will absorb more rapidly in a acidic environment like in the stomach. Okay, if the drug is more basic drug, it will absorb from a more basic compartment where it is in non-ionized form. Okay, we have already talked about the pKa and ionization constant in our first video. Then uh, there is another thing called inactivation of the drug. Inactivation of the drug before absorption, like we can say insulin. So insulin is a protein drug. If we take insulin orally, it is digested by the pepsin or proteolytic enzymes in our GI tract. So it gets inactivated before it gets absorbed. So we can't take insulin orally, we have to take it parenterally. Then there is another thing called interaction with other drugs. So there are the drugs like a calcium that prevent the tetracycline from getting absorbed, because it binds with the tetracycline and keep it in the gastrointestinal tract and don't let it absorb into the systemic circulation. Then we have to talk about the patience factor. Okay, so what are the patience factor that affect the absorption of the drug? It can be pH of the drug, pH of the gut. So if the pH of the gut in the patient is more acidic, more weak acid drug or acidic drugs will absorb more, but the basic drugs will absorb less. Then there is the rate of gastric emptying time. Rate of gastric emptying. So we know that the most of the drugs in our body, we take most of the drugs orally, and the major amount of drug is absorbed from our small intestine. If the gastric emptying time is less, or there is rapid gastric emptying, okay, so the drug will readily come into the small intestine and gets absorbed from this. Okay, so what we mean by gastric emptying time is the time the drug takes from coming from the stomach to the intestine. Okay, so if the rate of gastric emptying is more, then the absorption of the drug will be more. Then there is another thing we have to talk about is intestinal transit time. So most of the drugs are absorbed from the intestine because it has the big surface area. So if the intestinal transit time is more, then the drug cannot be absorbed greatly, or we can say that absorption of the drug will be less if the intestinal transit time is more, because the drugs are readily moved into the intestine, so they don't get the time to absorb through the mucosa into the systemic circulation. Okay, then there is regional blood flow. So let's assume we have taken the drug orally, and there is a less regional blood flow in the GI tract. If there is less regional blood flow in the GI tract, then the drug will get accumulated in this circulation, and there will be less concentration gradient, and this will lead to decrease in absorption of the drug. But if the regional blood flow is more, then the drugs will readily absorb because of the constant maintaining of the concentration gradient. Okay, then there is another thing we can say, this gastrointestinal disease. In here we can say that congestive cardiac failure that causes edema of the gut. So when there is edema of the gut, there can be less absorption of the drugs orally. Okay, then another thing that is important is presence of food into the gut. Presence of food increases the absorption of the lipid soluble drugs, but decreases the absorption of the water soluble drugs. Then here I want to describe a plasma level curve of drug absorption. You can appreciate this this curve, that if in x-axis we give time, and in y-axis we give plasma drug concentration. Okay, then you can see that in the 0 time we administer the drug. So this is the time we call lag period. So what is lag period? That in this time no drug is absorbed or reached into the plasma, or no drug is absorbed into the systemic circulation after administration. So this is the lag period. Then there is another thing called the we can say that is absorption and excretion. There's another thing called the minimum effective concentration. So minimum effective concentration is the level of the drug in the plasma where the effect of the drug is started. Okay, so this is the minimum effective concentration, means if the drug reaches this level in the plasma, then the effect or biological effect of the drug will start. Okay, so this is the time to reach the minimum effective concentration is called the onset of activity. So this is the time where the activity is not happened, or is the time the onset of activity. So when the plasma level crosses the minimum effective concentration, reaches the minimum effective concentration from the administration of the drug to the plasma level where the drug reaches the minimum effective concentration is called the onset of activity. Okay, then you can say that the curve goes like this, that the absorption is happening and it reaches a peak level in the plasma. Okay, it reaches a peak level in the plasma, and then it gets decreasing. The plasma level of the drug gets decreasing because of the excretion of the drug. So so in a time where the excretion is happening, there is a moment where the drug again reaches the minimum effective concentration and gets below the minimum effective concentration. So the duration of action, we can say that the duration of action means the duration of but the duration of the drug where the drug is in the plasma above the minimum effective concentration. Okay, so this is the curve, or this is the area of the curve where the drug level in the plasma was above the minimum effective concentration. This is the duration of action of the drug. So in this period, this drug gives its biological effect, or do its action on our body, and after that we can see the excretion. Okay, so this is the curve of a plasma level curve of the drug. So that's all for today. Thanks a lot.